Hi, everybody. I'm Catie Harris. I am a nurse practitioner and owner of the Philly Wellness Center here in South Philly. And one of the services that we offer is bioidentical hormone therapy. And so I want to talk to you today about why I think everybody needs to be on this and to give you more insight into what's involved in hormone therapy in general. So what I'm going to do is try and figure out how to play. There we go. All right, here we go. So the first thing that we need to address are hormone replacement fears. So in the minds of a lot of people, there has been from media and even from research studies talking about the negative effects of hormones. And one of the things that we'll talk about in later videos as well, but I want to touch on here, is that when they're talking about hormone replacement in the media and in many of these research studies, they are talking about synthetic hormones. So synthetic estrogen, synthetic testosterone. These are medications that have been altered. When I'm talking about hormone replacement therapy, I'm talking about bioidentical hormones. So these are the hormones that are in your body right now. Okay, so they can create the hormone of testosterone and estrogen that is absolutely identical, and it's bioidentical exactly to what is in your body. Your body cannot tell the difference between bioidentical hormone therapy that I give you and the hormone therapy that the body creates itself. It cannot tell the difference. It can, however, tell the difference between synthetic. And some of the problems with synthetic is that when they alter the hormone, it does things that weren't expected, and it creates an atmosphere that we'll go over in more depth that creates fears of cancer. It had some coagulation issues, so blood clotting problems. We saw all kinds of issues, all from the Women's Health Initiative. The Women's Health Initiative looked at synthetic hormones versus doing nothing, and doing nothing was superior to synthetic hormones. However, what they didn't compare it to was bioidentical hormones. So the real question is, how would bioidentical hormones fare in a study that is looking at synthetic, do nothing, and bioidentical hormones? And I'll tell you right now, there are literally thousands of studies that show that bioidentical hormone therapy is not only safe, but it's strongly warranted, and it's better than doing nothing by itself. Okay, so, but that Women's Health Initiative study really gave estrogens a bad rep, and we will talk about that in depth. But let's go over some menopausal statistics. Over 6,000 women in the US enter menopause every single day. 46 million women are over the age of 55. Women spend almost 40% of their lives in menopause. So if you live to a statistical norm of, let's say, 85 to 88, you're spending 40% of your life in menopause. 55% of women in menopause don't seek help. So 44 million Americans have osteoporosis, and 80% of those are women. 50% of women over 50 with osteoporosis suffer bone fractures. In 2010, more than 38 million prescriptions for HRT were dispensed, including 26 million for estrogen only, 5.2 million for estrogen progestin, and 1.4 million for estrogen androgen. So out of 38 million prescriptions, only 1.4 million were for the estrogen androgen, which is what we offer. This is a gross underestimation of how much androgen being testosterone, is required after that. After the Women's Health Initiative study results, when they were published, 65% of women stopped hormone replacement therapy, and rightfully so, because the women in the Women's Health Initiative study on synthetic hormones did not do well. Okay, they had a lot of complications. They saw increase in stroke, increase in blood clotting, increase in cancers. So rightfully so, but what they didn't learn and what the information they didn't get was that there was an alternative that was never invited into the study. And a little background on that, part of the problem is that when big pharma takes a new drug, they have to alter it in order to patent it. And that's where all the money is. Okay, there is no money in making and distributing bioidentical hormones. It just doesn't exist. You cannot patent a bioidentical hormone because it's just natural. It's like trying to patent an apple. You cannot patent an apple. And there's no money to be made in, just an apple, right? But what you can patent is an apple pie, right? You might have a proprietary apple pie recipe and you can patent that. But the question is, if you have an apple a day, how is this going to impact your health versus you have an apple pie a day? How does that impact your health? And I think that's one of the best analogies I can give in this situation, right? So, and then bioidentical hormone therapy, your three choices should have been no apple, apple, or apple pie. What is going to improve your health? So what should have happened in the women's health study should have been do nothing, bioidentical hormones, synthetic hormones. But the industries did not want that. One, because there's already massive research showing that bioidentical hormone therapy is not only effective, but it is really necessary for men and women. Now, andropause, this is basically menopause for men, or it's andropause is referring to testosterone, which women have testosterone as well. Testosterone has about 3,000 functions in the body, and in the hierarchy of things, it's testosterone, and it eventually breaks down into estrogen. Men don't break down their testosterone as much into estrogen, that not as much as women. Women obviously need much more estrogen than men. But both men and women do have testosterone, and it is a vital hormone in the body. So between the ages of 20 and 40, women lose about 50% of their testosterone production. Almost 40% of men over 45 years of age have a testosterone deficiency. They lose 1 to 3% of their production after the age of 35. Male and female hormone levels decrease with the aging process, and estrogen and androgen levels fall before, during, and after menopause. But, maybe you're like, well, that's just life. And as I get older, then I can expect to lose estrogen and testosterone. But, what I would say here is that you do other things to grow old gracefully, such as exercise. You lose lean muscle, so you exercise. Actually, one of the reasons that you may have trouble gaining lean muscle and building lean muscle as you get older is because of the decrease in testosterone. And then you try to lose weight. Another reason that you can't lose weight is related to lack of these hormones. You get skincare done. We do a lot of things to prevent the aging process. So we could just say that this is just a factor of growing older, but to be perfectly honest, if you don't have to allow your body to deteriorate, and if there was a way to keep it younger, wouldn't you want to do that? Symptoms of menopause. So I don't have to explain a lot of these to you, but hot flashes, heart and circulatory problems. So if you're all of a sudden having palpitations, your heart's racing, you have chest tightness, varicose veins, those are symptoms of menopause. Insomnia, difficulty sleeping through the night, waking up early. Depression, there's some statistics out there that show that 97% of women who used to be on antidepressants come off of their antidepressants when they're on bioidentical hormone therapy. So, but this depression, feeling down, sad, on the verge of tears, lack of drive, mood swings are the symptoms of menopause. Irritability, anxiety, indigestion, and there's a lot of symptoms of menopause. And the fact that 55% of women don't seek any help for this is a little bit crazy. Physical and mental exhaustion, general decrease in performance, libido decreases, bladder problems, difficult or frequent urination. These are all related to menopause. Vaginal dryness, joint and muscular discomfort, breast tenderness, hair loss, hair growth on the face, weight gain, and migraine headaches. So if you have migraine headaches that are just starting and you're perimenopausal, replacing testosterone and estrogen will actually help many, if not all of these symptoms. But are all these symptoms due to decreased levels of estradiol alone, the estrogen? So estrogen has multiple different, there's a hierarchy of estrogen, but it's not just estrogen, it's testosterone. And testosterone hierarchically is above estrogen, and it breaks down into estrogen. But if you don't have enough circulating testosterone, you're not going to have enough estrogen. So you can't have enough estrogen, but have decreased testosterone. It doesn't make any sense. So if testosterone has over 3,000 functions in the body, and you have a marked decrease in testosterone as you age, then your estrogen levels are going to be significantly less. And these are symptoms of decreased testosterone, including tiredness and fatigue, mood swings, irritability, tension, anxiety, depression, sleep disturbances. I mean, these aren't luxury symptoms. It's a big deal, all right? Anybody who experiences these types of symptoms knows how debilitating they can be in your everyday life. Like maybe you don't have the bandwidth to hang out with your kids, and then you feel depressed about that, and you don't think you're a good parent, and there's a lot of guilt that comes along with having symptoms that you don't think you should have, but you can't get out of the slump. You can't get away from these symptoms, mostly because you haven't treated the root cause, which is a decreased level of testosterone. Also memory. There's research out there that shows testosterone can help prevent memory loss, and there's a connection between low levels, decreased testosterone, and Alzheimer's disease. So increasing the testosterone can help prevent Alzheimer's disease. Vaginal dryness, decreased muscle mass, weight gain, especially around the belly, stubborn belly fat, joint pain, night sweats, migraine, menstrual headaches. And for the males, a lot of the same stuff, the tiredness, fatigue, the decreased muscle mass. So as men get older and they're going to the gym and they're trying to work out and build more muscle, they might turn to anabolic steroids, right? They might turn to synthetic IV or injectable testosterone because they can't build muscle mass. But those synthetic testosterones can be very dangerous, and they have a lot of side effects. Again, going back to the fact that Big Pharma has taken a hormone that is very, very good in the body, and they've altered it so that they can patent it and charge more money. So that's ultimately what it comes down to. But if you take a bioidentical testosterone and give it back to a man who has decreased testosterone, he will do amazing, and it will help with building muscle mass, particularly as we age. So weight gain, increased belly fat, decreased sex drive, loss of erectile function, joint pain, depression, tension, mood swings, all the same things that women have. Premenopausal testosterone deficiency. Premenopausal females may have decreased levels as early as their mid-30s and may have menopausal symptoms written off. So indication for testosterone pellets in women, PMS. You have really bad PMS, testosterone pellets will help. You have menstrual or migraine headaches, testosterone can help. Decreased libido, fatigue, sleep disorders, depression, postpartum depression. There's something that, I mean, how many OBs have ever offered testosterone pellets to women in postpartum depression? It just doesn't happen, but this is a treatment possibility. Autoimmune disease, they've seen a lot of great results in patients with multiple sclerosis in particular who have received testosterone. They've seen improvements. And if you have aches, pains, weakness, and bone loss, testosterone is wonderful for bone density. It can really help restore bone strength. So decreasing levels of testosterone in women, the normal range is considered 14 to 80. So here's a little caveat about normal range. So what they do is take everybody from the age of 2 to 92, right, basically, and add up all the levels and then divide by, 2, basically. And that's your normal range. So this is a normal lab range of 14 to 80. But we know from extensive studies, thousands of studies that have been done, that women who have a testosterone level less than 30, they will have significant symptoms. All the symptoms that we just talked about, all those symptoms are present and they're increasing in intensity. But if you get your testosterone levels tested by your provider, your medical provider, and the level comes back at, let's say it's 20. Well, 20 is considered normal in women based on normal lab draws. But we don't believe in the normal range. We don't believe in the average. We believe in what is the normal range of teenagers to early 20s, because that is where you have peak testosterone, and those are the levels that we're trying to achieve. So, we're definitely looking to be over 80 in women, get your testosterone up. Now at 30 to 50, you definitely have some symptoms. They're definitely present. You would be a candidate for treatment. At 50 to 70, you may or may not have symptoms. You may be symptomatic, but they might be mild enough that you consider that okay. And at 70 plus, it's considered normal. Now, every person that I've tested, at least in the last week, they were in their 20s, so their testosterone levels were coming back normal, but they're significantly deficient. So differential diagnosis of testosterone deficiency may include thyroid disease, chronic fatigue syndrome or Lyme disease, fibromyalgia, metabolic and nutritional deficiencies, psychiatric disorders, ovarian and hypothalamic problems. And this is one of the reasons that we do lab testing and a medical examination, because we want to rule these other things out. You don't treat with testosterone if there's other issues. So testosterone is amazing and it can help a lot of people, but it's got to be given for the right reasons to treat the right condition. Also, FSH, this is your follicle stimulating hormone. These typically go down as you become premenopausal, but if the FSH levels rise, you'll start seeing hot flashes of a few at the level of 23 to 30, 30 to 40, they're really beginning. 40 to 50, they're really intense, and now you have emotional symptoms of the moodiness, irritability, emotional ability. And over 50, you can throw in depression, joint pain, a bunch of somatic complaints, like physical complaints that people have. So, it's not just, menopause isn't just, I'm aging, I'm supposed to go through this as a rite of passage. It's not a rite of passage. It is not necessary to go through increasing levels of symptomatology from menopause. There are treatment options out there, and bioidentical hormone therapy is the biggest and safest one that you can do. Estrogen deficiency has been suggested as a state of accelerated aging. People with estrogen deficiency have their aging process accelerates incredibly. It brings on an extra 10 years very rapidly, right? So from the skin elasticity, the wrinkles, the fine lines, the sexual dysfunction, the emotional ability, all of it accelerates at a much faster pace. So it took you 40, 50 years to get here, and then the aging process occurs, it feels like, in months instead of years. And also, the other thing that happened with the Women Health Initiative is that women started avoiding estrogen. And they did a study in 2013, which showed that 18,000 to 91,000 estimated postmenopausal women between the ages of 50 and 59 who had undergone a hysterectomy may have died prematurely because they were not given estrogen, because everybody's so afraid of estrogen. And you should be afraid of synthetic estrogen, but bioidentical estrogen the kind of estrogen that your body makes is essential for so many functions in the body, and testosterone, so many, over 3,000 functions in the body. It's they're vital hormones that you need. So why does estrogen have such a bad rap when it is so vital for women's health? Well, that is what we're going to talk about in the next video, and I'll see you guys. I'll see you soon.